Carbonic anhydrase inhibitors are medications that reduce the activity of an enzyme called carbonic anhydrase, which plays a crucial role in the carbonic acid-bicarb buffer system, a series of reactions that help regulate body pH. In this system, carbon dioxide and water combine to form carbonic acid, with the help of carbonic anhydrase. Carbonic acid can then spontaneously dissociate into hydrogen and bicarb. These reactions can also occur in the reverse order. Normally, bicarb, sodium, and water are reabsorbed within the proximal convoluted tubule of the nephron, or the functional unit of the kidney. However, sodium and bicarb cannot diffuse freely for reabsorption. Instead, hydrogen and bicarb in the filtrate spontaneously combine via the carbonic acid-bicarb buffer to produce carbonic acid, which then dissociates into carbon dioxide and water with the help of carbonic anhydrase. Carbon dioxide can then diffuse into the cells lining the nephron, and the reverse reaction can occur to produce hydrogen and bicarb again, but now within the cell. Hydrogen then moves back into the filtrate in exchange for sodium via a sodium-hydrogen exchanger, acidifying the urine. Meanwhile, bicarb is reabsorbed with sodium via sodium-bicarb cotransporter. The movement of sodium creates an osmotic gradient, allowing for water reabsorption as well. Therefore, when carbonic anhydrase inhibitors block the action of carbonic anhydrase, it ultimately decreases hydrogen and bicarb levels within the cell. Without hydrogen and bicarb within the cell, sodium cannot be reabsorbed. The result is sodium, water, and bicarb retention in the filtrate, causing mild diuresis, alkalization of the urine, and potential blood acidification. Carbonic anhydrase inhibitors such as acetazolamide, methazolamide, and dichlorphenamide are available for systemic administration, whereas brinzolamide and dorzolamide are available for topical administration as eye drops. Most carbonic anhydrase inhibitors can be easily memorized by noticing that most end in zolamide. Carbonic anhydrase inhibitors are typically used with loop or thiazide diuretics to manage edema, as they have a weak diuretic effect alone. However, carbonic anhydrase inhibitors are actually more commonly used to treat glaucoma, as blocking carbonic anhydrase in the eye reduces aqueous humour production, reducing intraocular pressure. And finally, they can also be used to prevent altitude sickness, some types of renal calculi or kidney stones, and as an adjunct treatment for certain types of seizures. Adverse effects of carbonic anhydrase inhibitors include hypokalemia, metabolic acidosis, paresthesia or a pins and needles sensation, hepatic necrosis, and aplastic anemia or a decreased level of all blood cells, which can cause unusual bleeding or bruising and increase susceptibility to infections. They can also lead to the formation of kidney stones, different from the ones they are used to prevent. Although these adverse effects are serious, they are also generally rare. Topical carbonic anhydrase inhibitors can also cause additional adverse effects, including local irritation, such as burning or stinging, and an unusual or bitter taste, as the medication can drain from the tear duct into the back of the nose and throat. Carbonic anhydrase inhibitors are contraindicated with significant liver or kidney impairment, hypokalemia, and metabolic acidosis. During therapy with carbonic anhydrase inhibitors, regular blood work may be necessary to monitor electrolytes, such as potassium and bicarb, complete blood count, and liver function tests for potential adverse effects. Additionally, blood sugars may need to be checked periodically, especially in those of diabetes, as carbonic anhydrase inhibitors can cause hyperglycemia. Furthermore, unless contraindicated, increasing fluid intake to 2 to 3 liters per day may be recommended to prevent kidney stone formation caused by the medication. And finally, carbonic anhydrase inhibitors contain a sulfur moiety, which in rare cases can cause a cross-reactivity reaction in individuals with a sulfur allergy. I hope you found this video useful, and if you did, please let me know by giving this video a thumbs up, subscribing, and leaving a comment below. Thank you, and bye!